Vaginal candidiasis, commonly known as a yeast infection, is a frequent fungal infection that affects millions of women globally. It is caused by an overgrowth of a type of yeast called Candida, which is a microorganism that naturally lives in the vagina and other parts of the body in small, harmless numbers. When the delicate balance of the vaginal microbiome is disrupted, Candida can multiply excessively, leading to the characteristic symptoms of a yeast infection. This condition, while often uncomfortable and sometimes recurrent, is typically not a serious threat to overall health. Types of vaginal candidiasis. Vaginal candidiasis can be categorized into two main types: uncomplicated and complicated. This classification is crucial for determining the appropriate course of treatment. Uncomplicated vaginal candidiasis is the more common form. It is characterized by sporadic and mild to moderate symptoms. This type of infection typically responds well to standard short-course antifungal treatment. A diagnosis of uncomplicated yeast infection is usually made in women who have infrequent episodes, less than 4 per year, and are otherwise healthy and not pregnant. The infecting agent is almost always Candida albicans, the most prevalent species of Candida. Complicated vaginal candidiasis is less frequent but presents a greater challenge for both the patient and the healthcare provider. It is defined by one or more of the following factors. Recurrent infections. This is diagnosed when a woman experiences 4 or more symptomatic episodes within a single year. Severe symptoms. The signs and symptoms of the infection are intense, including extensive redness, swelling, and itching that may lead to cracks or sores in the vaginal tissue. Atypical Candida species. While Candida albicans is the most common culprit, other species, such as Candida glabrata or Candida krusei, can also cause infections. These non-albicans species are often more resistant to standard antifungal medication. Compromised host. Women with certain underlying health conditions are more susceptible to complicated yeast infection. This includes those who are pregnant, have uncontrolled diabetes, or have a weakened immune system due to conditions like HIV or from taking immunosuppressant medications. The distinction between these two types is fundamental for effective management. Uncomplicated cases can often be treated with over-the-counter medications, whereas complicated cases necessitate a more thorough medical evaluation and a more aggressive or prolonged treatment plan. Causes and risk factors. The primary cause of vaginal candidiasis is an overgrowth of the Candida fungus. Several factors can disrupt the natural balance of microorganisms in the vagina and create an environment conducive to this overgrowth. One of the most significant factors is the use of antibiotics. Broad-spectrum antibiotics, which are designed to kill a wide range of bacteria, can also eliminate the beneficial bacteria, such as lactobacillus, that help keep Candida in check. This reduction in protective bacteria allows the yeast to proliferate without competition. Hormonal changes play a crucial role in the development of yeast infections. Elevated estrogen levels can promote the growth of Candida. This is why yeast infections are more common in women who are pregnant, taking high-dose estrogen, birth control pills, or undergoing estrogen hormone therapy. The hormonal fluctuations that occur during the normal menstrual cycle can also make some women more susceptible to infections at certain times of the month. Women with uncontrolled diabetes are at a higher risk of developing vaginal candida. High blood sugar levels translate to higher sugar levels in other bodily fluids, including vaginal secretions. Since yeast feeds on sugar, this creates an ideal environment for Candida to thrive. A weakened immune system can also lead to an overgrowth of Candida. Individuals with compromised immunity due to conditions like HIV or those taking corticosteroid medications or undergoing chemotherapy are more vulnerable to yeast infections and may experience more severe and recurrent episodes. Other contributing factors can include lifestyle choices. Wearing tight-fitting or non-breathable clothing can trap heat and moisture, creating a warm, damp environment where yeast can flourish. The use of certain scented feminine hygiene products, such as sprays, douches, and scented pads or tampons, can also irritate the delicate vaginal area and disrupt its natural balance. Symptoms of a vaginal yeast infection. The symptoms of vaginal candidiasis can range from mild to severe and can be quite uncomfortable. Recognizing these symptoms is the first step towards seeking appropriate treatment. The most common and often most bothersome symptom is intense itching in and around the vagina. This itching can be persistent and can significantly impact daily activities and sleep. It is often accompanied by a feeling of irritation and burning, particularly during urination or sexual intercourse. Another hallmark sign of a yeast infection is a thick, white, cottage cheese-like vaginal discharge. This discharge is typically odorless. However, not all women with a yeast infection will have this specific type of discharge. Some may experience a watery discharge or no unusual discharge at all. Redness and swelling of the vulva, the external female genitals, are also common. The skin may appear inflamed and feel sore to the touch. In severe cases, small cuts or cracks in the skin of the vulva may develop due to the intense itching and inflammation. A burning sensation, especially during urination or sexual intercourse, is another frequent complaint. This is due to the inflammation and irritation of the vaginal and vulvar tissues. It is important to note that these symptoms can also be indicative of other vaginal infections, such as bacterial vaginosis or trichomoniasis, or even some sexually transmitted infection. Therefore, it is essential to obtain an accurate diagnosis from a healthcare provider, especially if it is the first time experiencing these symptoms or if they are recurrent. Seeking medical attention and diagnosis. If you suspect you have a vaginal yeast infection, it is advisable to consult a healthcare professional, particularly if it is your first time experiencing these symptoms, if you are pregnant, or if you have recurrent infection. A gynecologist or a general practitioner can provide an accurate diagnosis and recommend the most effective treatment. The diagnostic process typically begins with a medical history and a discussion of your symptoms. Your doctor will likely ask about the nature and duration of your symptoms, your sexual history, any medications you are taking, and whether you have any underlying health conditions. A pelvic exam is a standard part of the diagnostic process. During the exam, your doctor will visually inspect your vulva and vagina for signs of a yeast infection, such as redness, swelling, and discharge. To confirm the diagnosis, a sample of vaginal discharge is usually collected. This sample is then examined under a microscope in a procedure known as a wet mount. The presence of yeast cells, often seen as budding yeast or hyphae, confirms the diagnosis of candidiasis. In some cases, particularly for recurrent or complicated infections, a vaginal culture may be performed. This involves sending the vaginal sample to a laboratory to grow the Candida species. This can help identify the specific type of yeast causing the infection, which is crucial if a non-albicans species that is resistant to standard treatments is suspected. Accurate diagnosis is key to successful treatment. Self-diagnosing and treating with over-the-counter medications without a confirmed diagnosis can sometimes worsen the situation, especially if the symptoms are due to a different type of infection. Treatment of vaginal candidiasis. The treatment for vaginal candidiasis aims to eliminate the overgrowth of candida and alleviate the associated symptoms. The choice of treatment depends on the severity and frequency of the infection. For uncomplicated yeast infections, short-course vaginal therapy is usually effective. This typically involves the use of antifungal medications in the form of creams, ointments, tablets, or suppositories that are inserted into the vagina. Common over-the-counter and prescription antifungal agents include miconazole, clotrimazole, and tioconazole. These treatments are generally used for 1 to 7 days. A single dose of an oral antifungal medication, such as fluconazole, is also a common and convenient treatment option. For complicated yeast infections, a more aggressive and longer-term treatment plan is often necessary. This may involve long-course vaginal therapy, the use of vaginal creams, ointments, or suppositories for a longer duration, typically for 7 multi-dose oral medication, taking 2 or 3 doses of an oral antifungal medication, such as fluconazole, spaced a few days apart. Maintenance therapy. For recurrent yeast infections, a maintenance plan may be recommended after the initial infection has cleared. This typically involves taking a weekly dose of an oral antifungal medication or using a weekly vaginal suppository for up to 6 months, to prevent the recurrence of the infection. It is crucial to complete the full course of treatment as prescribed by your doctor, even if your symptoms improve before you have finished the medication. Stopping treatment early can lead to a recurrence of the infection. During treatment, it is often recommended to avoid sexual intercourse to allow the vaginal tissues to heal and to prevent any potential transmission to a partner. It is also wise to avoid using scented feminine hygiene products that can cause further irritation. Prevention and lifestyle modifications. Preventing vaginal yeast infections often involves making certain lifestyle modifications that help maintain a healthy balance of microorganisms in the vagina. Good hygiene practices are important, but it is also crucial to avoid over-cleaning. The vagina is a self-cleaning organ, and douching or using harsh soaps or scented products can disrupt its natural pH balance and eliminate beneficial bacteria. It is best to wash the external genital area with plain, unscented soap and water. Wearing breathable cotton underwear and avoiding tight-fitting pants and pantyhose can help keep the genital area dry and prevent the buildup of heat and moisture, which can encourage yeast growth. It is also a good idea to change out of wet clothing, such as swimsuits or workout clothes, as soon as possible. A healthy diet can also play a role in preventing yeast infections. Limiting the intake of sugar and refined carbohydrates may be beneficial, as yeast thrives on sugar. Including yogurt with live and active cultures or taking probiotic supplements containing lactobacillus may help to maintain a healthy vaginal microbiome. For women with diabetes, maintaining good blood sugar control is essential for reducing the risk of yeast infection. Alleviating symptoms and rehabilitation. While antifungal medications are the primary treatment for vaginal yeast infections, there are several things you can do to help alleviate the uncomfortable symptoms and promote healing. Applying a cold compress, such as a cool, damp cloth, to the vulvar area can help soothe itching and reduce swelling. Taking a sitz bath with warm water can also provide relief from irritation. It is best to avoid adding bubble baths, oils, or other products to the water, as these can cause further irritation. Avoiding irritants is key. This includes scented soaps, lotions, and bubble baths. It is also advisable to use unscented tampons or pads during your menstrual period. After treatment, it is important to continue with preventive measures to reduce the likelihood of recurrence. This includes following the lifestyle modifications mentioned earlier. For women with recurrent infections, a long-term maintenance therapy plan prescribed by a doctor is the most effective form of rehabilitation to prevent future episodes. Research and expert opinions. Research into vaginal candidiasis is ongoing, with a focus on understanding the complex interplay of the vaginal microbiome, the host immune system, and the Candida fungus. Scientists are exploring new diagnostic tools, more effective treatments for resistant strains, and novel preventive strategies, such as the development of vaccines. Dr. Jack Sobel, a distinguished professor and an internationally recognized expert in vaginal infections, has published extensively on the topic. In his research, he has emphasized the importance of accurate diagnosis and the need for individualized treatment approaches, especially for women with recurrent and complicated infection. A recurring theme in his work is the challenge posed by non-albicans, Candidiasis species, and the necessity of species-specific treatment. He states, "The one-size-fits-all approach is no longer tenable in managing women with recurrent vulvovaginal candidiasis." This quote highlights the shift towards more personalized medicine in this field. Another prominent voice is Dr. Paul Nyerjasi, a professor of obstetrics and gynecology who specializes in vulvovaginal diseases. His research has delved into the host factors that contribute to recurrent yeast infections. In an article in the journal Obstetrics and Gynecology, he noted, "For many women with recurrent yeast infections, the problem may not be the yeast itself, but rather an abnormal host response to the yeast." This perspective underscores the importance of considering the individual's immune system and other physiological factors in the management of this condition. In the book The Vagina Bible by Dr. Jen Gunter, a fierce advocate for women's health, she demystifies vaginal health and provides evidence-based information. She writes, "Your vagina is a self-cleaning oven. Douching is like a flash flood for your vaginal ecosystem." This accessible analogy effectively communicates the harm of douching, and the importance of allowing the vagina to maintain its natural balance. These expert opinions and research findings collectively point towards a more nuanced understanding of vaginal candidiasis. The focus is moving away from simply treating the infection to understanding the underlying causes of imbalance and developing more targeted and effective long-term management strategies. The future of treating this common yet often frustrating condition lies in a deeper appreciation of the vaginal microbiome and the individual factors that contribute to a woman's susceptibility.